Good afternoon, everyone. My name is Carla Ford, and this is Skills Demo 1 that I will be addressing. In regards to identifying one model of addiction that might best explain Marlowe's substance use, the model of addiction that I chose was the biopsychosocial developmental model of addiction. And the reason why I chose that because there could be accumulating factors of why he's using substances. When we talk about biologically, there's a history of alcoholism in his family. That's that nature versus nurture. Psychologically and cognition is what is his thought process as to why he's using and why he's engaged in this lifestyle, and is it part of cognitive distortions where he's saying, this is the reason why I'm using because I don't have this, which is a psychological and a cognitive form of that. And then you have the social environment. He is a young person in high school around a lot of peer pressure. His social environment and with his home life may not be conducive of him to be supportive of his environment where he can have positive pro-change behaviors. So there's a lot of reasonable factors with that. His developmental development also can be in the questions. So that's the reason why I chose the biopsychosocial model of theory to choose with Marlowe. And then the next one is students will discuss how you will incorporate techniques in motivational interviewing to engage Marlowe. What I would do to engage Marlowe with MI is just basically starting off with building that rapport, building that trust, understanding the fidelity of the relationship, because I am dealing with the youth in high school who probably has a lot of protective uh, um, factors, barriers that will make it hard for him to open up. So I'm going to build that rapport. Um, ask ask open-ended questions, and the most important thing in motivational interviewing is the meeting the client where he is at. And then the level of care. So you have somebody who is using marijuana, he's using prescription pills, in which I'm assuming are opioids. He's also selling methamphetamine to support his habit. So you, as from that perspective, he's enmeshed in his addiction. So one of the things that I would do is complete a because I want to treat the whole person care. So I would do a ASAM SUD screening, which um, is a screening tool that will determine his level of care. And it covers six dimensions. Dimension number one is intoxication, acute withdrawal symptoms. Dimension number two is, does he have any medical health concerns that would, number one, that he's neglected, because that's what happens in substance use. You neglect taking care of your teeth. You neglect physical. There may be some underlying symptoms. Dimension number three would be mental health, emotional behavioral cognition. Let's address mental health because maybe he's has an underlying diagnosis. Maybe there's traumatic brain injury. Maybe there's PTSD that we need to address. Dimension four, what is his motivation for change? Is he ready to go into treatment? Dimension five is high risk potential for continued use. What is his pattern of use, and how severe has it gotten it? And then dimension six, excuse me, is his living environment. Is his living environment conducive of a sober lifestyle? Based off of that screening tool will determine his level of care. Now, if he's using, depending on the frequency of use of prescription pills, then he would be placed in a 3.2 level of care, which is detox, 7 to 10 days. If he's not if he hasn't developed dependence and tolerance to prescription pills, then we consider residential treatment where he can gain tools of recovery living in a outside of his home, placing him into a residential setting where he's living in. If that level of care is not met based off of the ASAM criteria, then we would consider placing him in intensive outpatient treatment, which he's 17 years old. So it will be 6 hours or more in IOT, which is attending an outpatient clinic. If that level of care is not met in that realm, then we will put him in ODF, which is 6 hours or less, where he can come into to treatment groups, be amongst his peer, and have evidence-based curriculum taught to him by a certified addiction treatment specialist. In addition to that, not in lieu of, we would suggest him attending 12-step meetings within his community. So those are the things that we would consider, that I would consider placing this Mr. Marlowe in treatment to address his treatment use. Thank you.